Listen to the patient. He or she is telling you the diagnosis. This is not my words. This is actually given by one of the famous or the great diagnostician, Sir Dr. William Oscar. So before we move into the topic, case history and the regarding scenarios regarding case history, you should be able to understand what he is supposed to mean by that sentence. Listen to the patient. He or she is telling you the diagnosis. That means the most important element in history taking is the first portion, that is called as the case history portion. So the case history topic can be divided mainly into three, and this is actually a big vast subject. Slowly we'll go back to or come back to the different sections in different ways. So the case history portion can be completely divided into three main areas. One is the history portion, the second one is the examination portion, and the third one is the diagnostic portion. So when you have the first portion, that is the history portion, if it is astute, then it will be easy for you to diagnose a case, and the proper diagnosis will definitely result in the proper outcome and prognosis of the disease. So we'll go to the discussion. So as I said earlier, the topic. So this is the first thing. Listen to your patient. He or she is telling you the diagnosis. So like I said earlier, to get this proper diagnostic things, you that means that maintain a proper rapport. Within that rapport only you'll be able to get many clues regarding why the patient is receiving it. So when you come to the definition, it's a planned professional conversation done in order to reduce the anxiety, the stress, and the fear of the patient. So the patient is coming from a long way, taking an auto, taking a bus, spending a lot of amount of money to just visit you to find out what is the actual problem for the patient. So to identify the actual problem, listening capacity, what the patient is telling to you, and in order for the patient to open up his secrets or the clues what is present within him, he should definitely have a trust on the doctor. So to maintain that, the doctor and the patient definitely should have a proper rapport between each other. With that rapport only, it will be easy to gather sufficient information that will be giving you a clue for proper diagnosis. And when you deal with the patient, definitely you should have that both empathy and sympathy to understand the patient's emotion and also the expectation. And definitely it will be helping you for the proper success of the treatment and to diagnosis and treatment plan to future referral points or referring to other clinicians if any legal issues are present in that, for example, like any road traffic accidents or any assaults, any medical legal cases or any forensic things, and to see if a treatment, if they are planning for any treatment, what will be the outcome and progress of that treatment when you are taking the case history. So by definition, as I said earlier, case history is a planned professional conversation between the clinician and the patient that is used to alleviate the patient's fear, respect, and safety. So different types of case history taking are there, that's structured, semi-structured, or history taking. But whatever you take, definitely the first sentence like listen to the patient, he or she is telling you the diagnosis. That should be kept in your mind while you're going to take a case history. So the main components of case history, the main three components as I said earlier was the history portion, then comes the examination, and then comes the diagnostic part. So in the components, you have identifying the data, the chief complaint, history of presenting illness, and the medical, family, social, and history, all these things will come under. And so now coming to certain things, the data, to an OP card, and in that OP card, definitely the name of the patient, age of the patient, sex, all this things will be written. It is always better to greet the patient with a smiling face, and also definitely you can understand by the patient's appearance and address. That is very important thing because many diseases will be associated with certain region. For example, dental fluorosis or skeletal fluorosis will be more common in an area where the fluoride level of the blood is more. and then some types of anemia. So to know about the patient's locality, importance of address, you should be able to know by knowing the patient's name. For example, if a patient is telling, so Reddy name is usually not a name which applies to Kerala. Or you say some Velu Murugan or Muthu Murugan. So you should go back to the importance of name. Then the patient will tell that I am from Andhra. I am working here in some industry or something like that. So I visited here. So you should be able to know based upon the patient name also the address, the locality. So based upon the patient's attitude, you'll be able to understand whether the patient is present from this native region or other native region. And also to maintain a rapport with the patient, the address is very important. Sometimes when the patient is giving you the address, he or she will be your neighbor, or someone close to you will be their neighbors. So it will be easy to gather more information by maintaining a proper trust with the patient by the address. Then comes to the occupation. Occupation related disorders, especially for example, when we take into dentistry, most of the dentists in their mid age will be suffering from ankylosing spondylosis or back pain, neck pain, muscle pains, obesity, all these things. Because the professional life of a dentist is more in a sitting manner, less of physical act in the position and posture while we work on the patient. Most of the time we will be bending the neck and we'll be bending the back muscles. So most of them will be suffering from spondylosis. Same like that, any patient who is coming and visit you will be having some occupation related disorders. If it is a tailor will be having their own problem. Most of the people will be having tennis elbow. And if it is a traffic police officer or any people who stands long time will be having varicose veins. So occupation related disorder and the people who works in asbestos companies or any other things will be having more prone for respiratory disorders, asthmatic attacks, all these things will be there. So to know the patient's occupation will help to alleviate and find out any diseases which is associated with his or her occupation. That is one thing. Then you will be able to know about the economic status of the patient based upon the occupation. Some people will be well settled in the society. Some people's job will be something they having a limited economical status. So based upon that, when we plan the treatment for that patient, we can also inform regarding the feasibility whether the patient have that economical status or burden upon by the patient's occupation. Some people will be government officials, and based on their occupation, it will be easy for you to give a proper treatment appointment for the patient. Because some people will be working at the night time, some people will be working in the morning time or noon time. All these things you can be able to give based upon the occupation. The marital status, that is also having very important to find out the proper socio-economic status, the stress of a patient, and sexually transmitted diseases. The marital status gives us a clue regarding how well we manage the family, what is the family background, all these things. So now coming to the chief complaint. So in a professional conversation, the first thing which comes to you when you talk to a patient is called as chief complaint. And why we call it as chief complaint? Because this is the way we are going to address the patient. Why actually the patient came and visited you? And you are supposed to note that things in patient's own way. You are never supposed to use any medical terms while you write regarding the chief complaint. And the chief complaint itself is divided into major three things. That is the chief complaint why the patient is reviewed, and the region or location where the patient is feeling that complaint, followed by the recent duration. Not the past duration, but the at present why the patient visited you due to that chief complaint, and that chief complaint when it bothered the patient recently. These three things should be there in a simple short form in a minimal amount of words, maybe like one or two sentences, and you should not write it like an essay. For that there is a separate heading called as history of presenting illness. In the history of presenting illness you can definitely include all these things, but when you write regarding the chief complaint, the chief complaint should be minimal within one to two sentences, and that should definitely involve the main reason why the patient came and visited you, with the location of the or the region where the complaint affected the patient. I mean, within the oral cavity or in the adenoid region, followed by the recent duration. Still, people just remember that not the past duration, but the recent duration why the patient visited you due to that complaint. Then the next thing is called as sign and symptom. These two things are very important because sign is something that is elicited by the practitioner or the doctor or the physician or clinician from the patient. And symptom is something that is perceived by the patient. For example, a patient will come and give a complaint of pain. Then the pain is a symptom which is given by the patient or felt by the patient. Now, for example, the patient is telling me that the patient is having pain on the right hand because the patient fell down and he or she feels severe pain on the right hand. So the patient's complaint based on the symptom of the patient is pain on the right. Now, as a clinician or as a doctor, you are examining the right hand. So you started palpating the right hand. And when you palpate the certain area of the right hand, the patient felt pain. So when you pressed on that specific area, the patient showed severe pain. Due to your examination pattern and the pressing movement you have done on the patient felt pain. So the patient will give signs like, I'm getting severe pain. And the reason for pain is your palpation. That is the way we are going to identify the signs where the patient's body is affected. So the symptom is something that is given to you by the patient or the history given by the patient to you telling that, sir or doctor, I am having pain on the right hand. When you examine the same right hand and then you palpate to find out the region of pain, and then the patient felt pain, then you cannot call it as pain. You can call the word as tender based about the pain. And that is called as sign. So sign is a question you have to write in the examination part, not in the history symptom. And anything you write by identifying the patient or by examining the patient, all these things will come under sign. So when you take the term pain, pain is perceived by the patient and pain is a symptom given by the patient. And when you examine the region of pain and when the patient felt pain due to your examination, you can call it as sign. Then you should write tenderness or tender instead of pain. So when you write the first portion of history, you people listen carefully that you are supposed to write only pain in the history portion. And when you go to the next portion or the components like examination, the same pain you will be writing tenderness. So never use the word pain in the examination or diagnostic area. Only use the sentence pain in the chief complaint area. So now, for example, a patient is having more than one complaint. For example, a patient is giving a complaint of missing tooth on the left side. Again, a patient gives a complaint of ulcer on the tongue. The patient is having three chief complaints. So all these three chief complaints, you have to write in the chronological order. And for all these chief complaints, you are supposed to write a proper history of presenting illness. Very important criteria. One of them you become thing. You should, for example, if the patient is there. For example, a patient is coming to you giving a complaint of doctor, I'm having a DK on my right side of jaw since 2 weeks. You are not supposed to write same way. Patient complains of DK, not like that. You should ask the patient, do you have pain on that DK tooth? Then the patient will tell, yes, doctor, I'm having pain. Then the complaint is changed from DK to pain. Understood. So you should always ask the chief complaint along with the presenting illness. Then only you will be identified which is the very important or most important complaint for that patient. Sometimes the patient will come and tell you that, doctor, I came here to remove a teeth. You are not supposed to mention the patient came and is here for removal of the teeth. You should ask the question why. When you ask the question why, the patient will tell that I am having pain for that tooth. So the patient will tell that due to that tooth has been broken, that is impinging on my tongue, and I got an ulcer on the tongue. So all the chief complaint will change. The patient visited actually because of what? Ulcer on the tongue. Why the ulcer happened? It is because of the sharp tooth. The patient came for removal of the tooth for what reason? Pain. Like that. So when you take the history of presenting illness, it should be always, if you complain and the presenting illness, you should always ask the patient in a group manner, and based upon that, you formulate yourself regarding the sick complaint. So when you come to the history of presenting illness, for example, if the patient sick complains pain, you should ask about the presenting illness, like when did the pain started, how long the pain continues, and how the pain progresses, whether it is more at the night time or at the daytime. When you have food, whether it increases or decreases. When you have a cold food, whether it increases or decreases. When you have a hot food or when you bite on hard food substances. All these things you should ask about this. Then, is there any factors which aggravate the pain condition or any factors which relieve the pain condition? And if the relieving factor, for example, if it is a pain medication or anything, how long the pain got relieved? And is the pain is having any type of relieving features? For example, some people will tell that the pain reduced to my ear, pain reduced my neck, pain reduced my upper tooth, my lower tooth, my left hand, my right hand, and any other associated symptom due to that pain. For example, some people will not have sleep due to pain. Some people will feel it's very difficult for having food. They will be having very difficulty for chewing food. All these things we are supposed to ask. and any previous consultation or treatment or any investigation done for the same tooth or same cause previously. All these things you are supposed to mention in the presenting illness. That's why I told you before that presenting illness is a vast topic. It should be like an essay in your thesis, and the chief comment will be in one or two sentences, but you are writing the presenting illness in the presenting illness. So that includes everything. So at the end of presenting illness, in your mind, the diagnosis should come. For example, a patient is giving you a complaint of pain, and then you discuss all this things regarding pain with the patient. See, remember the last thing I have told you, a rapport between the patient and the clinician. Second point, listen to the patient because he is telling you the diagnosis. So when you listen properly by asking proper questions to the patient, from that point itself you'll be able to diagnose what is the patient main disease. Based upon that, if it is something related to dental, then functional disease, pulpitis, theoretical pathology, or anything. If it is neuralgia, you will have an idea whether it is neuralgic or not, whether it is bone related, TMJ related, or ulcer related, wound related, everything. You will come into a conclusion after completing the presentation. That's why I told you that chief complaint and presenting illness will go all in all, and you should have a keen eye. You should provide all in these two things. The next main important things are medical history. Medical history, for example, when in your third year, you will be reading about the general medicine topic and general surgery based upon differentiation systems. For example, CVS, CMS, GIT, respiratory system, GIT, I mean gastrointestinal system, genitourinary system, all these things. So every system will be having different parts and different disorders regarding that. Keep that things in your mind while you're asking the medical history, and you are asking the medical history to a live patient. And don't expect that the patient will be telling all the medical problems or conditions, what is happening to that patient to you. It is your duty to remind the patient regarding different systems. So the patient will remember that, yeah, I had a previous history of surgery done 15 years back. I had a history of a traffic accident 20 years back. I had a history of bleeding disorders at my childhood. I had a history of rheumatic fever. So the patient may not be remembering all the medical problems happen for the patient. So it is your duty to poke the patient's mind with proper history things regarding the medical condition of the patient. So some of the most common medical diseases or the systemic diseases affecting the patients like diabetes, hypertension, cardiovascular, renal, bleeding, any drug-related history, all these things can be asked. Then family history is very important because many of the diseases will be having a family, this one, genetic predispositions are there. So ask regarding that, any people or members in the family, whether they are having any problems like the medical situations or conditions, diabetes, hypertension, or anything like that, related diabetes, many people affected. Smoking is having a very important things in two types of smoking will be there: active smoking and passive, directly affecting to the patient. But the same way within the family, if the patient is in his house, the people in and around him also will be having an effect from the smoking, and that is called as the passive smoking. For the passive smoking, actually, there is no control for the patient. Is any smoke which is expelled by the patient is actually inhaled by. Sorry for the interruption. Any history of drug intake at present or before. All these things should be asked in very intake drugs or antiplatelet drugs or any drugs for any antibiotics or anything. So how long, and especially steroids. We never know that what type of drugs will be used by the patient. So you should always ask the patient regarding the different ways how the patient is using the drugs and how long the patient is using the drugs. For example, if the patient is using steroids for a longer duration, you should mention regarding that. If the patient is using antiplatelet drug for a longer duration, you should mention that. And twice all these things are supposed to ask that. And based upon that, you should have a prognosis and assess assessment scale, how the diagnosis will come, how the treatment will come, and what will be the prognosis of the treatment. So we'll continue with the next class regarding the examination question